Thank you, Senator. Senator Hassan is next.
Thanks, Senator Bennett. Thanks to the witnesses for being here today. I really appreciate you and your work. Ms. Hoagland, I want to start with a question for you. As we've heard today, Medicare Advantage plans are an important option for individuals on Medicare who are looking for more comprehensive benefits such as prescription drug coverage, vision, hearing, and dental. It's essential that we preserve this option for seniors, but we also need to ensure that plans are fairly and accurately representing their benefits. I have unfortunately heard too many concerns from constituents with Medicare Advantage plans who are unable to afford the medications that their doctors prescribe. While Medicare Advantage plans often advertise comprehensive benefits, many people are not explicitly told, as we're hearing today, by marketing agents that their plans do not include prescription medication benefits. Even for Medicare Advantage plans that do include those benefits, patients sometimes don't get appropriate information about whether or not their medications will be covered or if the coverage will change. So my office recently heard from a constituent in North Conway. She has a Medicare Advantage plan, but it has scaled back her prescription drug coverage. She uses several medications to treat her autoimmune disease, two of which were originally covered as preferred Tier 1 drugs under her plan with a low copay. However, the plan partially stopped covering the medications a few months later after she had already signed up, which added to her financial benefit burden. And she previously had a different Medicare Advantage plan that repeatedly denied her coverage for a third medication that she's relied on for more than a decade to manage her autoimmune disease, forcing her to rely on samples provided by her physician. Too often, consumers feel that the Medicare Advantage plans overpromise and then they under-deliver on results. Now, you, Ms. Hoagland, as the CEO of a small health plan with a good record, know what it is to do this well and right. How can we best ensure that these big plans provide the benefits that seniors need? What would you recommend we look at?
Yeah, so I appreciate this question. So certainly, I can't speak to the specific example, but, we've heard stories like this before. I mean, one of the things that we're really committed to is making sure that we maintain a comprehensive and affordable list, and really about working with the individual to address, right, if there is a change in formulary, but their provider, indicates that this is a necessary drug or there's concerns about side effects for transitioning, we really work with the individual to make sure that they maintain coverage through an exception process. And so, perhaps there could be some more work around how could that exception process work better to make sure that that there's consistency across plans.
Right.
The other thing that we talked about a little earlier is would a large enough change in the prescription benefit perhaps be something that could trigger an option for them to select another plan, because currently that may not be the case.
Got it. Thank you so much. Ms. Regg, I also recently heard from a constituent in Bedford, New Hampshire, who unfortunately has experienced the kinds of marketing practices that we've heard about in the hearing today. This constituent cares for her 26-year-old son who has a developmental disability and is eligible for Medicare. Her son was on traditional Medicare, but a Medicare Advantage marketing agent called his cell phone and got him to agree to switch his insurance. This company took advantage of him during a 5-minute conversation, leaving him with a plan that would not fully cover his health care needs. The good news is that his family found out about it the same day and was able to undo the changes just in time. But unfortunately, there is nothing stopping, as we've heard, this kind of unscrupulous marketing for these plans, and nothing stopping them from targeting the most vulnerable patients who may not have the resources that they need to navigate this kind of conversation. So, Ms. Regg, how can we prevent these kinds of tactics from impacting our most vulnerable populations?
I agree. I'm sorry to hear that story, but it's a story we hear time and time again. We've counseled individuals both under 65 on Medicare due to disabilities and individuals over 65 but with extreme cognitive impairments. And the record that we're able to view on Medicare's system through Marks shows an enrollment almost every month, which is far exceeding what the low-income subsidy special enrollment period allows. So we do file the complaints, and I think, again, knowing who that agent on record would allow us to take a step further in the side of enforcing those rules.
Right. Thank you very much, and thank you, Mr. Chair.